So my name's Amit Parmar. I'm one of the ENT consultants here at Midland Health. I also have another role as one of their commercial directors. Tonsils are essentially tissue that's lymphoid tissue that's in your mouth. Your body has lots of lymphoid tissue, but there's two specific balls of lymphoid tissue that sit within the back of the mouth, and they're called the tonsils. And in the vast majority of people, they actually cause no problem at all. But in some people, they can cause a problem, and if they do, they sometimes benefit from having their tonsils removed or shaved all the way back to the base. The sort of people that may get benefit from this operation are people that get lots of tonsil infections, which is what we call tonsillitis. So if you've maybe had a handful of episodes, it may not be the right thing to do because most people just grow out of their condition and it goes away. But if it's something that's really frequent and having a huge impact on your life, then having your tonsils removed can be beneficial. So in children, one of the most common reasons to have tonsils removed is because they can suffer from a condition called obstructive sleep apnea or sleep disturbed breathing. So the tonsils at the back of the mouth and sometimes the adenoids at the back of the nose can be so big that they can obstruct the airway and obstruct your breathing. And during the day it's kind of okay, but at night when you fall asleep and your muscle tone relaxes, there isn't much space for you to actually breathe, so you can snore really heavily and have sleep disturbance, and that can have an effect on a child's educational development and have other effects on their heart and lungs long term, which is why we consider this operation in that particular patient group. So when someone has tonsillitis, classically they would present with a really sore throat, finding it difficult to eat. They'll probably have a temperature as well and be unwell in themselves. And if they've got bacterial tonsillitis, they might have white patches on the tonsils, and their tonsils will be really large and inflamed. And often it's a diagnosis that's made by their GP or the out-of-hours treatment centre. So that's for tonsillitis. So that's how you'd know you've got tonsillitis. Often these are treated with antibiotics, but not necessarily always if it's viral in origin. In terms of the other reason why you may be having problems with your tonsils, that's obstructive sleep apnea. Often people themselves, they don't necessarily know that they're snoring heavily or have obstructive sleep apnea, so it's often the parents that can kind of reach that decision. But sometimes children and adults can be very tired during the day and absolutely exhausted. So if someone's having surgery, which is called a tonsillectomy or adenotonsillectomy, recovery can be up to 2 weeks. It is an uncomfortable procedure, but we ensure that you get given all the pain relief you need. That often forms a combination of paracetamol and ibuprofen to take regularly for nearly 2 weeks. And we also give you some morphine-based medication called Oromorph to use if the pain isn't controlled. And often for most people, that's enough. Nowadays we are using slightly different techniques to operate on people's tonsils and adenoids. It's called plasma tonsillectomy, or coblation is another word that's used to describe it, and that has lower pain levels, but it still can be uncomfortable, and we would still recommend that pain relief that I've suggested. The thing about sleep is it's such a complex domain that there can be many reasons why you're just simply not sleeping well, right? It can be behavioural or environmental. I mean, nowadays we all spend so much time on the phone. A lot of us will have it in our bedrooms. We're scrolling through stuff, constantly looking through things. And that's going to have a big impact, along with the environment. Is there a lot of light coming in the room? Is the temperature right? So there's all those aspects before we even get down to the medical aspect of it. But then the question is, once you are asleep, are you having problems then? Okay. The question is, at what stage in that whole sleep cycle are you having the problem? And that's why sleep is such a complicated thing. Sleep's something that's looked at by a number of different disciplines in the world of medicine. ENT is of course one of them, but respiratory physicians is another really. So from our side in ENT, we're looking at obstructive causes. So we're looking at actual physical, we're surgeons, we're looking at any growths or something that's obstructing your breathing in the upper part of your airway. For a lot of people, they can get a referral from their GP, and depending on where you live and waiting times, sometimes people do get seen quicker than they imagine, even within the NHS. But these things fluctuate, okay? So waiting times can fluctuate depending on season and appointment availabilities. But if people are struggling, and children are struggling, Parents can visit our website at Midland Health and they'll be able to book in an appointment to see either myself or one of my other colleagues or one of the other paediatricians that's available here at Midland Health.